now almost at the end of neonatology. Let us discuss some short topics in neonatology. So first is hypothermia. What is hypothermia? Hypothermia in neonates is defined as body temperature below 36.5 degrees centigrade. Okay. So 36 to 36.4 degrees Celsius is known as cold stress, whereas 32 to 35.9 is moderate hypothermia and less than 32 is severe hypothermia. So you can be just given a scenario or just a one-liner like 35 degrees Celsius falls under moderate hypothermia, whereas 36 degrees Celsius is cold stress. Okay. Now, what is the concept of warm chain? So, there is a very essential need to maintain the temperature in a neonate. So, there should be a warm delivery room. Whenever the neonatologist goes to the delivery room, must ensure that the delivery room temperature should be 26 to 28 degrees Celsius. Warm resuscitation, immediate drying should be there, skin to skin contact, encouraging breastfeeding, postpone the bathing, appropriate clothing will be there, rooming in, and we have to start breastfeeding within 1 hour of birth, warm transportation, training and awareness. So warm delivery room, warm resuscitation, immediate drying, skin to skin in contact, encourage breastfeeding, postpone bathing, appropriate clothing, rooming in, warm transportation, training and awareness. What is hyperthermia? Baby's body temperature is more than 37.5 degrees Celsius. That is known as hyperthermia. So let us read the differences between some swellings in the scalp, that is caput succedaneum and cephal hematoma. See, hematoma, that means it's a blood clot, right? So first let us study about cephal hematoma. It is located in the periosteum of skull bone and the bone. So it is periosteal bleed. It appears several hours after birth, so not immediate. It is mainly because of instrumental delivery and there is rupture of emissary veins in the skull. And since it's a hematoma, it do not cross the suture lines. So do not cross the suture lines. 2 weeks to 3 months, and supportive because it can cause neonatal jaundice. We need to treat it by supportive, and we need to remember that cephal hematoma can be the cause for neonatal jaundice. Now coming here to caput succedaneum. So location is the presenting part of the head. It develops immediately after birth and it appears early, goes early. So immediately after birth and goes early 2 to 4 days. Whereas its the time of appearance is several hours after birth and goes by 2 weeks to 3 months. So cause is prolonged labor causing venous stasis and edema. The extent of movement is both hemispheres crosses the suture line and we do not need to give any treatment to the baby. Okay. So have you understood the definition or the differences between caput succedaneum and cephal hematoma? Mainly remember, if a swelling comes early, goes back early, it is caput succedaneum, whereas if it comes later and the period of absorption is also later, then it is cephal hematoma. The cause of caput succedaneum is prolonged labor, whereas in case of cephal hematoma, it is because of instrumental delivery. Cephal hematoma, it is because of periosteal bleed, whereas in case of caput succedaneum, it's because of the presenting part of the head is the location. We do not need to treat any of the two conditions, but we need to remember in cephal hematoma, there is a chance of neonatal jaundice. So now let us study about the primitive reflexes. Okay. First is the palmar grasp. Palmar grasp appears at 28 weeks of gestation. It is fully developed in 32 weeks of gestation and the duration is 2 to 3 months postnatal. So rooting reflex, what is rooting? Rooting is 32 weeks of gestation, fully developed in 36 weeks and it is less prominent after 1 month. Moro is very important. Moro appearance is 28 to 32 weeks, fully developed in term, that is 37 weeks, and it remains 5 to 6 months. Tonic neck